Hi, my name is Deja Barhers, and I will be discussing the rising cost of healthcare in America. The cost of healthcare in America continues to rise each year. It makes people unable to pay for medical bills and medication, and the people who are most affected is the elderly. In the graph to the right, you will see how much the healthcare spending rises from 1965 up until now, and it also shows the predictions of the years to come. This is important because America has the highest healthcare costs in comparison to all other countries. Solutions that have been previously tried. There was a case study done in Alabama. The laws were changed for physician's assistants and nurse practitioners. A law that was changed for the physician's assistant was that a constant presence of the physician is not required, and the practice broadens under delegation of a supervising physician. And for a nurse practitioner, it includes diagnosing without physician's involvement or documentation. By changing these two laws, over a 10-year period, it can result in a net savings of $729 million. The study was assessed and be able to save millions of dollars. By doing so, it can make the healthcare costs in America to start to decrease. Propositions that I would like to make is to make Americans more aware of what they are paying for. Most people go to the doctor or go to a hospital and they receive a doctor's bill or a hospital bill and they don't know what they are paying for. I believe if Americans know what they are paying for before they go, it will help them save money. Also, we can get Medicare to negotiate prices for medication. So where's the money going? First, a relationship needs to build between the patient and the doctor. This relationship will open a line of communication and it will help the doctor know what the patient can and cannot pay for. Some doctors do have their prices available online, but most people, when they go before they go to the doctor, they do not check online to see what prices they have. So doctors should be able to show their prices in the reception area when patients come in so they know what they are paying for. Also, doctors should give options for different procedures. Meaning, if there's a procedure that has to be done in one place and in another place is just as effective, just as safe, but it's a little cheaper, then the patient should be able to make the decision of which place they would want to go to. By doing this, it makes patients more aware of the options. Patients are able to do research before paying for a service that they need or want. It also helps patients save money. Also, more information equals healthier citizens, and more information means that more people will be able to go to the doctor, mostly for the elderly. Medicare negotiating. To start this process, you will have to update the law to allow negotiations, and lawmakers will have to establish which law will apply to all plans. Next, they will have to find which medication is available. Not all medications will be available at first, but this will be a great start. Next, you'll have to pick the solution in which will be the most cost efficient for people. This will help the elderly to receive their medications at a lower cost. More medications will be available, and the solution will lower out-of-pocket costs for patients. Is it feasible? Talking to doctors to improve their communication with patients is very easy. It can help patients starting today. It can help patients know how much money they can save or how much money they can spend with medical procedures. Trying to get Medicare to change their laws will probably take some time. If people will start talking to the policymakers, or if they have already started talking to them, being determined is what is key, because it will make the lawmakers know that this is a major issue, and it will help them with the decision and change of policies. In the graph to the left, you will see who has the most difficult time in affording their prescription drugs. You can see in the age group from 50 to 64 years old, they have the most difficult time. And then it would be from ages 65 and older, and finally ages 18 to 49. It also shows how much money people spend per month on medication, with 58% of the people spending $100 or more per month on medication, and 17% spending less than $100 per month. A call to action. If this problem is not fixed, the issue will pursue, and prices for the future generation will continue to go up to the point where nobody will be able to afford medical needs anymore. Fixing it now will help future generations. Making a change today will bring a better tomorrow. And this is my reference page. Thank you for listening.